I don't know, I'm so excited. Actually, I couldn't believe, so I'm taking my time to yeah, to digest the information. But yeah, I'm very happy.
I'm very happy and proud. I'm very happy and proud. Proud of
Thank
you because I
you.
know how was how the journey itself.
Yeah, yeah, it is a hard journey. And we have a lot of insecurities. Also being assessed is not nice. It put you so vulnerable, like you feel so exposed. Um, but yeah, and then you have like you feel like you have to prove yourself not only to you but to everyone else. That's quite hard. So yeah, it's really good to see that everything you're doing is working and you're going in the right direction. So yeah, really happy.
I know the feelings before success during the preparation time and the feeling after success is completely different feelings.
Completely different because beforehand you don't know if you're going on the right track. You rely on others as well, like other people's experience, and you just have to trust. And sometimes trust is really hard. And then just when you get the results and you see that everything worked out, it's just like you feel so powerful. So yeah, it's completely different. It's like from vulnerable to invincible in one day.
I
So yeah.
agree. I agree in this because I know when someone passes the exam, especially this exam, it's more about not just one step in a course or one step in a degree. It's all about your life.
Yeah.
And that's why you feel your life completely changed.
Yeah,
So
exactly. So it's a huge step. And of course, everyone that is going through this process, it's doing a life-changing sort of thing, like going to another country, another culture, another language. So it's a lot of things involved. And then you have a process that you have to go through, so you can have a better life as well. So sometimes people have families relying on them as well. So it's a huge pressure. Like it determines your future. Easy. Like you go to do something 2 days that's gonna define your life. But what is really important is that it's not only you don't have only one chance. You can it's a process. So you can, as long as you don't give up, everything is going to work, like it's more than just knowledge, it's also maturity. You also have to build confidence, be comfortable in such uncomfortable environment. It's a lot of things, so yeah, it's a huge step. um yeah, but it's worth it. It's completely worth it.
yes, I agree on it, and that's why are here today, and that's why everyone is happy and proud of you. Anyway, let's start. I think now this is going to be the good start, and then everyone will be happy. So,
Mhm.
okay, guys. So, I'm not quite sure if you can hear us or not. If you are on Facebook and you're on YouTube, I are here right now in Zoom. So, guys, we are now in three different platforms, and we are in a very nice beach. I can see, right? And this, I can the waves. The waves is actually behind Dr. Joyce, right?
Yeah.
And then we enjoy. I think we both enjoy now this place, right? This view. It's very nice place, very nice view. I really enjoy it. And she's very happy, and I'm happy
Yeah.
for her success as well. Okay, guys, so please, if you actually go into be on the Facebook, please let us know if you can hear us there. And also when you're on YouTube as well, please, guys, let us know, guys. And then, so let's start right now. And then definitely, I will start first by congratulating Dr. Joyce. So congratulations, Dr. Joyce, first.
Thank you.
Thank you very much. And definitely, guys, I thank her very much for coming today and then share her own success story, her own
Mhm.
experience, what she did differently, because I believe every one of us has different circumstances. We have different stories and also different experiences. So we learn from these experiences. And I believe even Dr. Joyce, one day, she has. Did you watch any stories and someone who has passed? Did you get any information from anyone?
Oh yeah, definitely. If mostly before the exam, I was just I was listening to every story because it gives us so much hope. Like it's just because you pass such a long time preparing for something, and sometimes the time you prepare makes the obstacle like bigger than it is. So when someone is achieve, you just feel like, oh my god, it's really possible. And then you hear the stories, and sometimes you feel like the message like is for you. So yes, definitely, I think that's one of the most important things, like hearing other people's experience, so you feel like it's doable, it's feasible. So yeah, definitely. I was listening to many stories before.
Okay, that's very good. Okay, guys. So please, guys, you see now the spirit. I believe this type of sessions giving you good steps and good visions about what you need to do for the next futures. So now Doctor, okay, guys, please, guys, everyone say congratulations first, Dr. Joyce, please, guys, because it's not just only we congratulate her today for what she has done from great job, because I know every one of you went through lots and lots with hardships and obstacles to achieve this point, but I also congratulate her because she passed her part one and part two from the first attempt. Am I right?
Yeah, you're right. I don't know how, but yes. So that was really good. Yeah. I just
Actually,
want
really,
to thank you as well, and all the tutors and Dr. Alifia. It's like everyone has a whole it has a role in our preparation and in the process. And I would like very much to thank you for your words. As I told you before, I was clinging on that as well. Um, so yeah, I was just trusting on the process. After part one, I just felt that I was on a right guidance, and I tell my friends that as well. When they ask me what course should they go, it's like I would just trust and go with blindly. And everything worked out well. Like I didn't have any surprises. Yeah, I felt prepared, and also I always felt like supported as well. Like I always had someone checking on me, answering my questions, reassuring me as well. I remember during the on-site course, I had Dr. Bido several times showing me like almost getting my hands and showing me I should do some stuff, like some procedures, some tasks. And also Dr. Olivia, she was just beside me showing me how to do amalgams, which I didn't know how to. So since the first time, so yeah, that's the kind of thing you actually hold on to like during the process, like make you feel more confident as well, because as we are being assessed, we as like I said, we feel very much vulnerable and exposed, and it's really good to have people around us that just yeah, just show like how good you are and how doable and possible the process is. So yeah, I just would like to thank you guys.
thank you very much for this, Dr. Joyce. And by the way, you always my motivation because your words right now makes me uh, work harder, look after the candidates more, pay
Mhm.
more attention, give more efforts for
Yeah.
everyone and care as well. So thanks very much for saying this. And by the way, I feel more into responsibility and definitely I try to help everyone. I know I may be busy because I still work, I still do, I have my own stuff, which is
Mhm.
mostly toward the candidates. Most of my life is toward the candidates.
Yeah.
However, uh, because when I get every day lots of messages and then I need to prepare things, I need to be in academy with part one and Oscar sessions, the day already is gone. Like I don't have any time during the day. But saying this, even if I'm tired, I really work hard and even give more care.
Yeah.
Thanks so much for this.
Okay.
Okay, and let me thank you very much for coming to help all the champions here today
No
because
worries.
thank you very much. This I really appreciate it. Okay, now, guys, I can tell Dr. Joyce from the academy. I told her she's going to pass when I saw her in the academy. Am I right?
Yeah, you did.
Okay.
And I hold on
Um,
to that as well. Like I was, Dr. Guido said I was going to pass. I probably am on the right track.
yeah, so when we say you're going to pass, because we know it, because you see like how hard work you do. Definitely all the champions they really put hard work, but sometimes when you see the champions really listen carefully, they really put all the efforts, and then because it's a whole process, it's not just only to be good. You can be good,
Mhm.
but how to show this?
Yeah,
And you are this person. You are good. Your handwork was good, and then your communication skills good. You're really smart, and then you're not really
mhm.
that. You still somehow stressed, but not very much stressed.
Yeah, yeah, yeah.
I can see this. There's because we all
Mhm.
at some stage can be under some stressful situations. We can be stressed, but the only difference between person to person, how to control the stress, right?
Yeah,
So
yeah,
it's more
yeah,
like package. So that's
yeah.
why, guys, this is my advice to everyone. We need to see this package in every one of you. Okay, okay. Now, doctor, we need to give advice. It's now definitely your success. You share it the way you want. You go
Okay.
through it the way you want. The champions they may ask questions on Facebook. I will be here
Yeah.
reading the questions for you. You
Oh,
don't
okay.
need to go there by yourself.
Yeah.
Okay, that's okay. No pressure at all. I'm going now through them. If there's any questions, they will ask you. So now I will be
Mhm.
listener, right?
Okay.
I will be enjoying what you're going to say. I will learn from you. And then, yes, and then if you need any help, I'm still around here. If you want me to tell you exactly the questions from the champions, I will do as well.
Okay.
Okay?
Yeah, please, because I don't have anything here. So yeah. Um,
Okay.
well, I'm from Brazil, just to give a little bit of brief. From Brazil, I've been a dentist in Brazil for 5 years, and I came to Australia because it was my partner's dream, and I also thought that would be very interesting to go abroad. So I just said, "Oh, that's a nice idea. I think I'm gonna have a very good story to tell if I go to Australia, even if things doesn't work out." So we just decided to come, and we really loved living here. So I just decided to straight away to start my process on ADC. Um, but yeah, it was not it it was just like I didn't have much, I didn't plan that much. So I came here and I wasn't expecting all the changes. I think probably most of you guys who's already living here probably experience the same way, like with the culture, with the language. So I struggled a little bit at the beginning, especially with the language, with English. So like my first job experience didn't go very well because I didn't have enough English. So all those kind of things. But yeah, I think I've just put it effort. Like I would wake up really early in the morning and I would just get an English lesson and I would practice. I also like to read a lot, so I just promised myself I would not read anything else in Portuguese anymore, like for a while. So I'll just read things in English so I can improve my vocabulary. I would read things out loud, those kind of things. So I just put a lot of effort. But yeah, you always, as I said, you always feel insecure, like you have a lot of things going on at the same time, doing during the adaptation. So ADC was Another thing that came along the way, that I had, that I really had to put efforts on to achieve. Like, I love dentistry. I loved being a dentist when I was in Brazil. So I really like to study. I like to make difference in patients' life. Um, and yeah, so I was like, I would like to be dentist here in Australia. I think I can make difference, and I think I can help people as well. And also, like, being a dentist is just give you such a comfortable life, as I can see. So I was really excited, but I was a bit afraid because I had this jobs experience and my English was not good enough. So I was like, oh my God, in practical exam, I'm not sure how I'm gonna do it. But anyway, so I had a dentist, which I was working on the practice that I'm still working. She said, "Oh, I've done the Dr. Beetle courses and I cannot thank them enough. Like, they had been so supportive with me. So I would just tell you, just go with them, and I think you'll be all right." And then I think it was very lucky for me because I only went through Dr. Beetle's guidance and everything worked out. So I remember getting, during my part one, I was I was a bit lost because I was studying to the exam, and I was also working, and I was also on a student visa, so I had a lot going on at the same time. So I couldn't follow everything, and that makes me go crazy because I like to be very organized and go through everything. Like, otherwise I get very anxious, but I just accept that because that's really impossible for you to read every single thing. And so what I've done is I just went through all the classes. That's what I can tell for sure that I've done is I watched all the classes. I've made notes of everything. And whenever I couldn't make any notes, I would just go through Telegram and see what other people's wrote down, and I would just revise them over and over again. I would do the mocks. I think I probably done the mocks maybe twice or three times, each one of them. And also, of course, like the main articles and books, I've read them. But I think for part one, the best thing to do is just listen to what Dr. Bido says. Has a lot of knowledge regarding the exam, so it's really important to to listen and to understand the concepts. Like at the beginning, I would just think that oh, I just need to know dentistry. But if you don't know like the criterias or what ADC wants from you, it's really hard to to get there because there is a logic behind it. So I think I've just trusted, and I just went through everything he said and what he would tell us to do and what to read and what it was important and what it was not. So yeah, that's what I've done for part one. Everything went right. And for part two, I took my time, to be honest. So I took like a year to do the practical examination. I took a small break. And then I've done my home setup and I've started studying. For the technical, it took a little bit of time because I preferred to go first to the on-site course because like it was quite expensive for me to practice. Like it's you have to have a lot of instruments and teeth and also the materials. So I was always like, maybe I shouldn't start practicing before I know what I really need to do. Otherwise, I'm just gonna waste money and efforts. So I went to the on-site course. They gave us a very good um they showed us how the exam, how it works, how we should do and what we should aim. So when I came back home, I tried to do both, like study for both parts of part two, but to be honest, I it was really hard for me to manage because some days I would just be very focused on technicals, and some days I would be very focused on communication. I couldn't, it was really hard for me to do both. Like I had friends that they could just program themselves to, like, morning I would start communication and afternoon I would start technical. I get lost in time. Like it wasn't feasible doable for me. So but I always tried to do a little bit of everything. Um, and yeah, I think I managed well, but I think I just would like to say this because sometimes we make a perfect scenario on our minds, and I do that very often with everything. Like I'm a bit perfectionist, and I'm also always a bit like anxious if things not go as I plan, which is something you just get have to get used to because sometimes we plan things on your head like, oh, today I'm gonna study I don't know, like the 5 cases, and then I will do 3 procedures, and then you finish the day, you not even done half of it. But you have to know that you've done your best. Like you show up every single day, you building confidence, you doing you do what you need to do. As for part one, like doing all the questions over and over again, attending to the classes, or for part two, just to look over the cases and do the procedures and revising the criteria and see if you're on that, and where you can improve, also asking for help. I think for part two, it's really important to have people around you all the time. And I think um like just before the exam, I've started doing a lot of role plays on Telegram. And that was really helpful because I had different people all the time. So they would ask different things for me. So I was going to be a little bit more prepared um, for the surprise that I might have. Um, so that was really helpful as well. Um, but yeah, I think I'm a bit confused, but I hope you guys can understand. But yeah, there any question for me that I could
Yeah,
maybe
thank you very
inspire
much for
me?
this. Yeah, thank you very much for this information. I really love the way you said you love the industry, and I would say this is the best way. The best
Mm-hmm.
way in the life is to like what you do, to love what you do.
Mm-hmm.
Um, if you do some works and you don't really like it, you don't really love it, I would say you want to be successful in it.
Yeah,
And I love the way when you said you start talking your own language, Portuguese, and then you start to speak only in English. And this is something very, very important
yeah,
because we all understand bilingual, right? We're bilingual. So in this case, you really need to focus on the exam until you pass the exam. Pass the exam and then get your job and then up to you, right? Do whatever you want. So definitely this point as well was a very important point. So I really like it very much. Now there is a doctor actually. Oh, you see okay, Dr. Mylene. I think do you know her, right?
yeah, she's my friend.
She's your friend. She said she told you the same. She told you you're going to pass too, right?
Yeah, she told me that, and I was like, oh, you're too nice.
Yeah. So I can tell she likes you very much, and she was right too.
Yeah.
Okay. There's a question here. This question. Please, guys, ask the question again because the problem is Facebook, especially in my app, when I try to get the first comments, I they actually been hidden somewhere. So please, guys, if possible, you can ask again. Okay. Now, there's a question here. Dr. Hent mentioned.
Mm-hmm.
She's now asking for part one. There is 3 weeks left before part one. What is advice? Need advice for that. And she cries.
Yeah, that's pretty normal. I cried a lot as well. Like my husband, he was just getting used to see me crying all the time. So that's normal. Just don't feel guilty for being nervous or anxious. Like there's a lot going on. Sometimes we are very close to the exam. We feel like there is not much we can do. Like what's done is done, but it's actually not true. Like 3 weeks, there's a lot that you can go through, especially doing all the mocks again, attending the classes, taking all the doubts. What I would mainly say is sometimes we try to just shut on ourselves, like close to the exam, because we try to get control over everything because then we feel like we are safer. But it's really important to be in touch with the tutors and also with the classes as well, because I always have this, like close to the exam someone will tell me something and will come up, like always. So it's really important because you're not alone in the journey, even though like you don't have any close friends or anyone that's going through the same process. Like you have people that are on the same boat. So it's also really important to be there, like to go to attend the classes, to hear what everyone is saying, and yeah, just to participate and also just focus on the exam. 3 weeks, I would say. Just breathe ADC. It will be worth it. Like if you have anything that you can postpone or just maybe take a break from work, or yeah, just do whatever you can to focus on the exam. And but also just go out for dinner, go study in the park. I would do that always because sometimes I would feel overwhelmed at home because I couldn't stay at home, because if I stay at home and I look at my dental and my home setup and I would say, oh, I should be practicing, or I look at my computer and say, oh my God, I should be studying. So it's really easy to be overwhelmed in at home. So I would just say go to a park, just see some birds and study a little bit, have a nice coffee, just enjoy life during the process as well. Like it's really important. But the anxiety, like there's no way we can avoid that, but definitely there is a way that you can manage to not let it control you, because I would say when you get there, in within 3 weeks, it's not gonna be the anxious student is student, like the person that is being assessed. It's going to be the dentist that is there and has the knowledge to manage all those situations. So you just have to hold on to that, because all of us, we are all professional. We've all been through much worse things. Like, so it's completely feasible, and you just have to trust yourself and leave your insecurities for at least like 2 days, and then just do your best. I think that's what I would say for both parts, especially when we're getting close. Just don't blame yourself for being um, nervous or anxious. This is completely normal. Just try your best to manage that. Yeah.
Thank you very much, Joyce, for this. So, that was really great. I always notice this always happening right now from the successful champions. They don't pressurize themselves a lot. They always go like for now, I believe the last five, six champions, they share their own success stories. They mention the same things that they go out for dinner at night somehow, and then they do some sports, for example, and then they go for a walk, and then they distract themselves from stress very much.
Yeah.
And I do the same sometimes, but not always because I have no time. But yes, I agree on this. I totally agree.
Yeah,
Okay.
I've told you that when I met you. I said you need to take some rest. And he said,
Everyone,
"You don't have time." I said, "But you should."
yes, you know what? Everyone tells me the same, and I'm trying to do my best in it. I'm just getting closer to it right now, which is not very. I'm not very successful in this part yet, but I will be soon. I'm sure about this. Thanks very
Yeah,
much
but
for.
you love your work. So yeah, it's something that when work is really important for us, it's a big part of our life. It's just normal for us to be involved in it. Yeah, it's just what we do.
I
So,
agree in this. Exactly the way you love the industry, right?
yeah. Mm.
Dr. Haya asked you another question. By the way, guys, we going to start our lecture after Dr. Joyce, and this is will be about Vita Barb therapy. So we'll be here, guys, until we actually go in together with Dr. Joyce, and then after this, we will do the Vita Barb therapy. Dr. Joyce, seems like I have lots of questions here for you.
Oh,
Okay.
happy
There's
to
another,
listen.
yeah, thank you very much. There's another question from Dr. Haya. She say,
Mhm.
Doctor, she asked, Doctor, how did you improve your English?
Well, I would just breathe English. Like I don't consider myself like I'm not there yet, but I aim for a very fluent English. Like that's my one of my goals. Like languages is something that's really important for me. So in my native language, I always choose my words carefully. So when I got here and I had such a strict vocabulary and I couldn't express myself, I always felt like I was somebody else, not myself, just because I didn't use the appropriate words. So that's how I think. So sometimes that's not very helpful because I see people that work out really well, like and they're very confident. So English was a really, I think, was mostly the hardest part for me during the process because I was always down that I probably won't be able to explain things in the best way, those kind of things. So what I've done is I would read um, books in English. I would study grammar, like English grammar in use, like the grammar everyone studies. I would do like at least 1 unit per day. Um, I would try every day at my work to talk as much as I can, but I would also forgive myself because some days we're just not there. You're like the English doesn't English, so it just doesn't come out. So just forgive yourself and then keep going. I also used to have like audiobooks just to improve the listening. Like it doesn't have to be like any sort of dentistry books. I would just like random books, like books that are fantasy books or crying books, like those stories. Just find something that you enjoy, and I would just yeah, I would just be there. It would be like a relaxing moment, but I would be learning as well. So that's what I've done. Like I'm still not there, but I think it's always a process. Like you're not gonna get the perfect English in 2 months. You need time, but it's a continuous process that is going to be improved from time to time. Just be patient with yourself. I try to tell myself that as well. But yeah, that's it. Just do your best daily. Like something that I realized is that I had Portuguese classes since I was 5, and I would do everything. My mom would just uh, tell me stuff in Portuguese. So I don't have all those experience in English. So how could I ask myself to be completely fluent in a language that I never had much experience? So you just have to wait and do your best to do what you can, but just wait a little bit because it comes, like it's a process. So we learn every day, I would say.
Thank you
I
very
hope
much.
I
Yes, I
answered.
appreciate it. Yes, I know this, and we learn, like I told you, everything you say right now, I learned something from it. We learn, definitely we learn. I agree on that. Okay, there is another question here from Dr. Tolika. She
Hmm.
said, she asks, any tips for part one exam?
Yeah. Well, part one, I think TG is the most important thing that you can read over and over. But definitely my to-go tip would be do the mocks and the papers as much as you can. And what I've done close to my exam was I would have a small notebook that I would write down what I've learned from that question. Like sometimes close to the exam, you don't have time to learn a huge concept, but at least you can understand the logic behind it just by going through the question. So I would have this notebook that I would just put everything that I've learned from that question, what was important, and then just before the exam, I would have that notebook and I would just read all my notes over and over again, and somehow things get into your head, and when you get there, you will see how things make sense. Like everything is going to make sense. So I would do the question, and whenever you answer anything wrong, that's okay. You're not gonna do 100% of anywhere. So that's okay. You just like think that you made that mistake, so now you have the opportunity to learn and understand why you've done that mistake, and then you're not going to make that mistake during the exam. So I think that's the most important thing to do. Go to the classes, um, every tip that Dr. Beto says, or every concept, or everything he explains, just write down on the same notebook, and then go over and over again until the exam. So definitely that's what I would do if I had an exam coming up.
Very close, very soon. Look, they are actually very lucky because we provide them with something called Bidu Bytes. It
Oh yeah.
has, yeah, it has all the topics and stuff because that wasn't in your time, Bidu Bytes. Maybe you have seen a little bit
Oh,
of diamonds at your time. Maybe it was diamonds or cakes, some of
yeah.
them, but not Bidu Bytes. So
Mhm.
they are lucky because we actually provide them these days with Bidu Bytes. And then the Bidu Bytes is more like notes. And then in
Mhm.
this notes, they have all the things being nice explained there. So they can add up there. They can add up the information from TG, from any other, from Odell, from any other book to Bidu Bytes.
Yeah,
So
that's good. Yeah.
so, okay, and definitely attending the sessions. I agree on this. When you attend the session, write down the notes and stuff. That's going to help a lot. I agree on this
Yeah.
too.
Definitely, yeah. That's what I said, like what I've done 100% was attending to the classes and doing the papers, the mocks, every sort of question I could see in front of me, I would just go through. And then I would, if I have time, I would go through the source, like TG I would read all the time, but like if I had to go to hotel or some of the articles, I would only do that if I had time, like if it's feasible. Otherwise, you just get very overwhelmed by the amount of things you have to read just before the exam. Um, so yeah, I'll just say that. Go to the classes, do the questions, and yeah,
You
that's
mean
it.
the mocks, doctor? Doctor,
The
you mean
mocks,
mocks
yeah.
is mostly that
Yeah, the mocks, the
like
weekly mocks that you discuss every week, like
yeah,
every
the two
class.
sessions, like
Yeah,
the sessions and stuff, right?
yeah.
Okay, that's
Mm-hmm.
right. Okay, so Dr. Leo, she's asking question. I don't know if you know her or not. How was your study methods in part one? Did you have
Mm-hmm.
to stop working at any point?
To be very honest, no. I should have, but I didn't, because it was not something that I could do. I've tried, but my work was rely on me as well. So what I've done, I just took a week off but I would study all the time. Like even during my lunch break, I would have questions to do. So I was trying to make up for that. But my work wasn't hard. I'm still working as dental assistant. I already resigned, but yeah, I've been working as dental assistant here. So it's like it's a very physical, tiring job, but not mentally, I would say. So I would do the questions as soon as I get home, and I would study. And also, I'd like to wake up really early. So because I would have like, I would feel more with more energy. So I would do the questions as well. So that's what I've done before the exam because I couldn't take a break from work. So, but I would, if I could give an advice, I would say a month or at least 2 weeks, just for you to focus on the exam, so you have nothing to worry about. I would say, yeah.
Okay, that's great then, doctor. Okay, there's another question actually from Dr. Ying. Dr. Joyce,
Mhm.
was your dentistry course in English or Portuguese language?
It was in Portuguese. To be
Wow.
honest, in Brazil, we learn English, but very basic. We need English when we go through scientific articles, but otherwise, you just don't need. So, I remember studying for written examination, and I had to read things in English. It took a little bit of time, but you get used to it. Later on. So my speed was getting better with the time, but yeah, was not something that I was used to. So yeah, that was something that I had to manage as well. I could not be very quickly when I was studying because I was studying something in other language. So even the words would be different. Like I couldn't translate straight away because it wouldn't make any sense. So I just had to learn what is the word for that thing that I think I knew in Portuguese. So I kind of have to learn everything all over again. So yeah, it's a bit.
Great then. Okay, Dr. Camila says, congratulations, Joyce. I am really proud of you, Dr. Camila. Seems like you know her too.
Yeah, I do.
We all, Dr. Camila, proud of Dr. Joyce, definitely.
Thank you.
Yeah. Okay, there is another question here. Dr. Hai thanks you very much. Dr. Hai say thank you, doctor. And then, yes, we have Dr. Tolik as well. Thanks you very much for answering her question.
No, thank you.
Okay, and then Dr. Anna asked me, it's Bido bites, which is the second one, not the first one, not bites. Okay, yes, because they ask, is it Bido bites? Okay, there's a question here as well.
hmm
How did you manage to study OSCE and technical together?
Yeah, it wasn't not I don't think I've done very well because I had friends that could manage like do the OSCEs in the morning and then afternoon technical. I think I only done that twice because I would get so involved in what I was doing that I just get lost in time. So sometimes I would feel guilty because like, oh my God, that's been 4 days that I haven't done technicals, and then there's been 4 days that I haven't done OSCE, and I'll get really desperate. So for me, really hard to manage. But I've done anyway. Like I wouldn't take much longer between those two. Some days because it's really I think it's for me it's really easy when I start doing the technicals just to get lost in time, and then at the end of the day I'll just feel my neck sore, and I was, oh my God, yeah, that's because I spent like 6 hours focused on a tooth. And then the same thing happens with me when I'm studying the cases. So was quite hard to manage, but I've heard a few friends that manage quite well, like separating the hours. Like, oh, I would wake up like at 6 and I would start OSCE because sometimes OSCE because it's an second language, those kind of things. People prefer to start with the OSCEs. So, and they would study like 4 to 5 hours and then have a break, have a lunch, and then during the afternoon do the technical. And it worked out really well for them. Um, but yeah, I didn't manage to do that. But it worked. So if you're also struggling with that, don't worry. You just try to do your best and study every day. I think that's the most important thing.
That's great then. So they shouldn't give up, right? So they shouldn't stress themselves,
No.
and then they should keep going, whatever happening.
Keep going because to be honest, as I said, it was not a joke. I would cry every other day because I was like, oh my God, things are not working. My amalgams were really nice, and then I didn't do amalgams for days, and then when I do amalgams again, it is not there. So I would like, oh my God, it's not gonna work, but it does work because when you're there, you just gotta do your best like so things work just you have to trust in the process and you just keep showing up every day and just accept the fact that not every day is not going to be the same like you're not going to feel motivated every day or sometimes some days I would see to do the technicals and everything is going to go wrong and I say okay I think I'm going to go for OSCEs because technical is just not working today and that's fine. So yeah, just don't give up. Just if sometimes we do need a break, sometimes we are so overwhelmed, and I know we have to study, but sometimes when it's not working, just go for a walk. Just try to rest your mind, and then the next day you start again. So that's what I would say. That's what I've done as well. Some days just go to the park because it wasn't like doing much, to be honest.
I know. Okay, now tell me about your feelings before and after the exam now, please. After you pass the exam, after
Oh,
you achieved, I would say, the things you've been dreaming about since long time.
yeah, I'm very simple. Like, I never aim to have like of course, I like to have a comfortable life. In Brazil, I was always struggling with money. Like in Brazil, things are very hard compared to Australia. So here, I think I was just aiming to do what I like to do, what I've learned to do. So I think that's the thing that I'm mostly happy about. Like now I have the permission to do what I like to do. So I think that's how I'm more pleased about. But it's also so nice to have like a validation from because I know that um we should not aim to prove ourselves to other people all the time. Like we have to be we have to do things for ourselves. Like everyone's got their own path, their own journey, their own difficulties. So that's the most important. Like you on your own. But sometimes it's so good that you see things working, like you see all your efforts pay off, like you have this validation from the outside as well. So it's just it is exciting and also yeah, it is really good. So it's completely worth it. Like going through the process, you learn a lot. Like I came and I said, "Oh, it's an exam for a dentist," but I'm already a dentist, so it shouldn't be that hard. But I've learned so much during these 2 years. Uh, so just just be present, like just be there, do your best, just learn everything over again, just go through the same concepts we once learned in university. It's always important to study, and your effort's gonna be paid off. So it's actually what I'm feeling like. I can't believe it's over. And I'm very grateful that I've been through this process. And people would say to me, "Oh, it's so unfair that people needs to go through this process if you're qualified in your own country." Um, that's okay for me. Like, I will learn during the process as well, so that's fine. So yeah, just take the chance to improve as well and to be better. So yeah, that's what I'm feeling now. I'm feeling very pleased and very happy that everything worked and all the things I've learned as well, and all the possibilities that has have ahead of me. So yeah, that's how I'm feeling.
I'm very happy for this, and I feel it. I feel it right now. Feel how much you're happy, and you
Yeah.
deserve. You really deserve. Thank you very much. There is a question here right now. It's from Dr. Ara. She says,
Mm-hmm.
master degree. I think this question, we both can answer this question together, okay?
Mm-hmm.
A
Yeah.
master degree in dental public health will help me in my ADC journey or not, as I am planning to get a master from Australia. What do you think?
I think every knowledge is important. But I think ADC process has their own logic, and so I think even though you should try to understand the process as well, um I think that's really important. If you have an exam to do, just try to, whatever the exam is, just try to understand what they are asking for. So definitely, it will help, but you also need guidance. You also need to understand what you should know, what you should have to go through the process as well. I think that's the most smart thing to do when we put ourselves through assessments and in general.
Yep. Look, I agree in what you said right now because this is exactly my answer. My answer is definitely it will help.
Mm-hmm.
When you get into master degree, we'll learn a lot of, at least the system in Australia. One of the things has helped me during my process is because I studied master degree. However, it was different things. It was in business finance and business law, but I learned outfit. Just imagine, was it dentistry, but still learned lots of things. I learned the system in Australia somehow. So
Mm-hmm.
definitely it will help. Definitely it will help. But EDC, as you said, or dentistry in Australia, it has a very specific nature, very special nature. So they should understand about it, which is going, they may learn some of it during the master too. Yes, so that's
Mm-hmm. Yeah.
Dr. Joyce. Look, this is a time right now, which
Mhm.
I and everyone here from the bottom of my heart, we congratulate you.
Thank you, Dr. Vito. Thank you so much for this journey, actually, these 2 years.
Yes, I know I know how hard it was, definitely for you, but I believed in you. And same exactly, I believe in every champion here because I know it's doable, it's possible. You may the get struggle between, but finally it can be nicely done. Do you
Yeah.
agree on this?
Yeah, definitely. And to be honest, sometimes when we were getting close to the exam, and then some candidates would just tell you how overwhelmed and how they were doubting themselves, and you just stop and just like spend 30 minutes making us feel confident. I think was the best sessions, to be honest with you. So yeah, that's really important. Like it's not an easy process. We feel very much vulnerable. So it's really good to have someone that cheers us up. So yeah, thank you.
Thank you very much. Well, anyway, we're going to start right now, pub therapy class session right now. You are very welcome to, if you have time. I know you just came from work. I can see you in the form,
Yeah.
right? So, yeah, I noticed this, and I know you know what you remind me with by myself. I do the same. I come home with my uniform, my clothes, without even changing my clothes. Just do my sessions. So I know this feeling right now. And thanks very much for coming and everyone. Even you didn't change. Did you have dinner? No, right?
No, not yet. No.
No yet. Okay,
Not
then
even
please.
hungry, to be honest.
Okay,
I would be in normal life, but not today. No, I'm not even hungry.
okay.
Just happy
Because
to
you are
be
very
here.
happy, right? You're very happy. You are here today, excited, happy. You're going to
Yeah,
be between all the champions today. I know this feeling very well.
yeah. Thanks, guys, for listening to me. I hope that I've made any difference in your preparation or maybe a bit of motivation. Or yeah, so thank you for listening.
Look, you definitely motivated me. I believe lots of the champions has been motivated too. Thank
Oh,
you.
that's nice. Thank you, Dr. Bidu. Thank you so much.
Thank you very much, Dr. Joyce. And again, if you want to attend the session, that would be good for for pub therapy, right?
Okay, yeah, thank
Otherwise, if you're
you.
tired, you can now just please and you
Thank
can
you.
have your then. Okay. Thanks very much, Dr. Joyce. Again, congratulations to you.
Okay.
Thank you
Bye.
very much. Thank you.
Thank
Bye
you,
bye.
Dr. Bidu.
Okay.
Bye.
Thank you. Bye bye. Bye bye. Thank you. Bye.
Bye.
Okay, guys, now you will not see Dr. Joyce for now, her beautiful voice, right? You will only hear my voice. I don't know. This should be boring for you. I'm not quite sure. Okay. Okay, guys, so let's start right now. The session should be a very interesting session. And by the way, every one of you guys can be here one day. Everyone can be Dr. Joyce, right? It's, I believe, I may forget even to ask her about what she thought when she started the journey. I believe the question is lost. The answer is lost. And that's true. Because when we start something for the first time without enough experience, especially the experience of the people around us sometimes is negative experience, demotivating experience. People say, I couldn't pass the exam, it's too hard to pass the exam. They put you down, right? So in this case, definitely you may feel lost. So that's why every one of you can be Dr. Joyce today, right? Everyone can be successful like her. Definitely, she is amazing dentist. I met her personally. I know how amazing she is, and I believe, guys, in you too. You too. One day we'll pass the exam, and then we'll celebrate you here too. And please, guys, say again, congratulations, Dr. Joyce. And please, guys, thank you very much. She may left now the session, but really she deserves it very much. Okay, now let's start with Vitapub therapy. Let me share my screen. Vitapub therapy is very important subject for your exam. Very important. I would say highly one of, if you choose 3 to 4 topics, I would say Vitapub therapy or pulp therapy is one of the top, including caries. If you're asking me my opinion, what are the most important topics you must know before you go to exam? I would say dental caries, definitely, pulp therapy, and then perio, it can become third, maybe, and then any other subject or any other topics, including pros too. But definitely, every one of this topic I mentioned right now, it has its own part of professionalism. Professionalism, it's not a separate subject. It's a subject or topic which is involved in the other topics. Like pulp therapy today, it must have a part of it for professionalism. A part of it will be for information gathering. A part of it will be for diagnosis and management cluster. And a part of it will be definitely for treatment planning and evaluation cluster too. Guys, are you ready to start right now? I check on the Facebook as well. See, guys, if you're ready. If you're not ready, I will not be ready. You must reassure me that you're ready, guys. Okay. Yes, ready? Thank you, Dr. Sugmeet and Dr. I will be Dr. Okay, Arazo. Yes, you will be definitely Dr. Arazo. Arzo. And then, oh, Dr. Joyce saying, thank you, Dr. B. Thank you very much, Dr. Joyce. Okay, everyone is here, guys. Everyone's ready, right? Okay, let's start right now. Guys, can you see my screen? By the way, if you want to be on Zoom, you can be on Zoom. But if you want to ask questions, so in this case, we'll be on the Facebook. So I can read your comment there. Please, guys, if you see my screen, let me know. Pulp therapy. Write down this in your notes. Before you decide on the treatment. By the way, guys, if you have attended one of my sessions before about pulp therapy, I'm telling you today, you will find me discuss new concepts and new ideas. So please, guys, write down what I'm saying now. Pulp therapy. Before you start treatment of any pulp condition, either for a child or for an adult, you always need to think and ask yourself a question. What is my objective behind this treatment? What exactly I'm looking for after I do this treatment? I give you an example. If we do pulp therapy for a baby tooth, what should be your main objective in this? What think, guys, the answer here? If you are planning to do pulp therapy, right, for a baby tooth, what is the main objective? Definitely baby tooth, we don't need for root formation. Yes, because root formation for the last baby tooth, which is the second baby molar, it will be, right, will be complete about 2 years, 3 years, 4 years, let's say. So we don't care about the root formation because it will be nicely formatted. Very good. Preserve vitality for a baby tooth? Not really. This is not the main objective. Now, Dr. Razo mentioned retain till it is age. I agree. So the main objective to do pulp therapy, right, for a baby tooth is space maintainer. So maintain the space. Guys, am I clear about this point right now? I'm giving an example because this is going to give you an idea what exactly going to do today. So now, if we're talking about a baby tooth, let's say a child, he is 4 years old. He actually complains or suffer from trauma of tooth number 61, which is primary right hand side central incisor. In this case, If you want to save this tooth by any way, it doesn't have pulp exposure or any other type of trauma, why should I treat this tooth? Is to preserve the pulp? Not really. I don't need the pulp in anything because easily I can mummify the pulp. I can clean it, sterilize it, right? And then kill it by myself just to ensure, as long as it's necrotic, let's say, right? Or there's exposure or anything, just to preserve the tooth. So the most important thing is to preserve the tooth, to keep the space, right? Until the right time of exfoliation. Guys, did you get my question right now? Did you get my example? My question. If I ask the same question, see guys how dentistry can be easily tricky. If I ask the same question, but by the way, guys, when I say something right now, I'm not saying for fun. I'm saying it because I'm sure this concept is important for your exam. You may get a question regarding this concept, right? So you need to ensure what you hear right now, you write it down nicely and you digest it nicely. So now the second, let's ask the same question, but I will change the keyword right now. Same question as, what is the main objective to treat a tooth or a pulp for a permanent tooth? What is the main objective to treat the pulp or to do pulp therapy for a permanent tooth? If your answer is like exactly Dr. Razo, I will love it very much, which is maintain vitality, right? I love it. To preserve, the right word we go and say right now is to preserve the pulp. Let's guys play this game again. Do you wanna guys play the game again? Let's play the game. We're gonna play the same game, but this time with different keyword. Let's now do another keyword. What is the benefit to treat immature? You see now the keyword has completely changed. Immature permanent tooth. What's the benefit to treat the pulp in immature permanent tooth? Thank you. If your answer right now has changed, as Dr. Mariam mentioned, which is root formation, you are now on the right track. Guys, is it clear right now when I say before you start any pulp therapy, you must think about the objective of your treatment? Why this? Because the objective of the treatment is going to help you to decide on the medicine you're going to use. For example, let's play this game again. Okay? Do you remember, guys, what was the objective of pulp therapy in deciduous tooth? Do you remember, guys, what's the objective? By the way, guys, most probably this session will not be recorded. And the Facebook is very bad right now. Facebook delete the video sometimes immediately after we finish, sometimes after a week, sometimes after a month, which I don't understand why. To space, okay, space maintenance is very good. Thank you very much, Dr. Rabi, saying this, and Dr. Parisa, right? Now, if this is the case, do we really care about the pulp? I don't think so. Do we really care about root formation? I don't think so. So in this case, if you have a baby tooth and you need to keep the whole tooth, not the pulp, you don't want to preserve the pulp, you want to keep the whole tooth in place to maintain the space. In this case, wow, this is like poetry, right? What did I say right now? If you want to maintain the space. I don't know what I said, right, guys? It's something is right? So in this case, what you're going to use, what you're going to do, in this case, we need to preserve the tooth. How to preserve it? Don't care about the pulp. What we need to use is we need to mummify the pulp. Mummify the pulp. How do you mummify it? Is it with calcium hydroxide or with formacrysol, for example? Definitely we gotta discuss about formacrysol and ferric sulfate, the difference between both. But now, to mummify the pulp means to make it nice and clean and sterilized rather than to preserve it. To preserve the pulp, you may need to use calcium hydroxide to preserve it, right? But to mummify it, to kill it intentionally, to make it clean for a short time, in this case, we need to use ferric sulfate or formacrysol. Now, let's apply the same concept on the immature, permanent tooth. The same concept. Well, again, let's now recall this point. What is the objective of treating the pulp of immature tooth? What is the objective? The main objective, immature. Immature means the root is incomplete. Root formation. Perfect, Dr. Parisa. Thanks very much. So now, what or which type of medicine can enhance the root formation? Which type of this medicine, either formacrysol or ferric sulfate or calcium hydroxide, can help in root formation? If your answer is calcium, thank you very much, Dr. Ryan. Please, guys, everyone like Dr. Ryan answer and Dr. Parisa. If your answer is calcium hydroxide, you're really doing great. Can I use formacrysol? No. In immature adult tooth, you cannot use formacrysol. Can I use ferric sulfate? No. Because if you use ferric sulfate or use formacrysol in immature adult tooth, you're going to kill the pulp. And then you will not go in to get root formation done nicely. So definitely now the choice is calcium hydroxide. Very good then. I'm happy you got this point right now. So guys, again, let's get back into the main point. Before you decide on the medicine, before you decide on the correct treatment, what do you need to think about first? Before you decide on which medicine you're going to use inside the root canals or the pulp chamber, before you decide on the right treatment, is it pulpotomy, pulpectomy, pulpicapping, dark pulpicapping, and dark pulpicapping? What you need to define first. Very good. Please, guys, everyone likes Dr. Shashank. Dr. Shashank answer. Objective. The main objective. Why I'm doing this. Seems like it's an easy concept right now. Let's decide on it and break down this concept in steps one by one. Now, let's say what could be the most important information gathering parts as clusters. You have a question right now, and the question in exam will come with lots of information. The information really you need to pay attention to it in your scenario is one, medical history. Why medical history? I'm going to give you some conditions that medical history can change your decision of the treatment. Like what? Let's say this is, guys, applied for adult and also applied for babies as well. Let's say if a baby has rheumatic heart fever, let's write down this. Patient has rheumatic heart diseases. Just make it as this, all the disease together. Rheumatic heart diseases. What do you think is the main issue can happen in this patient? If your answer is endocarditis, like Dr. Mariam, it means, right? It means you really understand the concept. Now, if there's a tooth here, like this molar, and then there is a pulp inside, and then there is pulp here as well, in this part. So if you're going to do any vital pulp therapy here in this area, and then there is infection happen inside the pulp, this infection, the microbes, bacteria, germs, will move from the canals all the way through the pulp down there. Imagine to where? To where? To the heart. In this case, we're gonna end up with a high risk of infective endocarditis. So now the question here, if patient has a history of rheumatic heart disease, are you going to recommend pulp therapy? The answer is unlikely, right? So in this case, we all need to do the treatment as Dr. Shelba mentioned. Dr. Shelba mentioned we need to do what we call it as aggressive treatment. Yes, like doctor, but you mentioned before we really need to keep the tooth to preserve the space. Yes, here that's exactly what you need to do in exam. You need to apply a concept, we call it risk, benefit analysis. Why this concept in Australia we apply before? Guys, I'm trying now to teach you the proper critical thinking, because in exam, most probably what will happen is you will not get a straightforward question, guys. Unfortunately, you will not get a straightforward question. What you're gonna get is like they're not coming easily and tells you if patient needs for example treatment, right? And they give you photo, and then they tells you what's the treatment should be done here. And then you think the treatment is vital pulp therapy. Okay, did you read the question properly? Did you read there is a rheumatic heart fever there in this scenario? Have you noticed this? Yes, doctor, you know what, but I couldn't think this way because I thought when the child and then they have a baby tooth and then the pulp is exposed, in this case, we need to preserve the pulp. True, you're not right. Sorry, you're not wrong. But in real life, which exactly the exam case is going to be because it's a part of real life, you're not going straight forward situation like this. So you must have the critical thinking. And that's like actually what I'm teaching you here right now. So what is the critical thinking here? The critical thinking part is one, you need to decide on the objective of the treatment, as we discussed. Two, you need to read the scenario properly to get all the relative, the word now you need to use it as relative information, right? And the keywords. Three, what you need to do is you need to be save dentist. You must be safe dentist. To be a safe dentist, you must apply what we call it as risk benefit analysis. Am I clear now, guys? That, by the way, guys, this is a part of my Bido techniques because I'm working now on the Bido techniques, which I will discuss it with my champions in the private classes. Sorry, guys, this is will not be for everyone. That's only will be for our private champions, okay? Yes. So that's, guys, a part of Bido techniques, how to reach the right answers of lots of questions in exam. Now, we done this. Let's apply the same concept on different medical condition. Patient on warfarin. Now, what is the issue, guys, with warfarin? What is the issue now with warfarin? It will result in, if your answer is bleeding, you're totally right. Dr. Parisa mentioned risk of bleeding. I agree. Now, if risk of bleeding, I have the same tooth, the same molar, right? That's a molar right now. And you have two options. One is to do extraction, exo. The other one, pulp therapy. Which one you go into, which one? It can be higher risk of bleeding. Pulp therapy will be higher risk of bleeding, or extraction will be a higher risk of bleeding. Which one gonna be more safest to you? Dr. Muhammad asked question here, Dr. Question. If we find RCT to be a treatment for patients at risk of endocarditis, do we proceed with it or extraction? Extraction, doctor. We mentioned if the patient has a risk of endocarditis, we do aggressive treatment. So as a safe dentist, when we apply the risk-benefit analysis, right, guys, that should be very quick in your mind in the exam, right? So in this case, we do extraction rather than root canal treatment. Very good. Everyone starts to say extraction. Thank you, Dr. Rabia. Yes. Why? Because now we are worried from bleeding. Patient on warfarin. Warfarin will result in bleeding. Now, which one has a high chance in bleeding? Exo has a high chance of bleeding, or pulp therapy has a high chance of bleeding? Definitely exo. So don't do exo and do pulp therapy. Clear now, guys, the importance. Now I need to teach you four things. One, the importance of medical history. Two, to think about the objective of the treatment. Three, to read the scenario properly and get the keywords. Four, be safe dentist and apply what we call it risk benefit analysis. Am I, guys, clear so far? No problem, Dr. Muhammad. Okay. Let's now discuss important point. Information gathering will be mostly given to you in the scenario. The scenario will mention either cooperative patient or uncooperative patient. If the patient is cooperative or not cooperative, uncooperative or not cooperative, which one you going to treat today? Are you going to treat the cooperative patient or the uncooperative patient? Which one you going to treat today? Dr. Mehek asked question, patient on warfarin and tooth not restorable, then Dr. Bedo. So in this case, as long as root canal treatment can be an option, so in this case, we go with extraction, but should be atraumatic extraction after we check INR for warfarin. And it should be between 2 to 3.5. INR should be between the number 2 to the number 3.5. So which one we're going to treat today, cooperative or the uncooperative? I'm waiting for the right answer because so far I haven't seen the right answer. Which one we're going to treat, guys? Keywords. Okay, I will tell you the right answer. Okay, the right answer is, you know what? Why we can because if I share the screen, yep. The right, thank you. Please, guys, everyone like Dr. Camila comment. I am the first one. Gonna give you a big heart, Dr. Camila, for this. It does say to delete you. No. How come I delete you? Should get big heart. Right, both. Please, guys, ever like Dr. Camila? Yes, both. It's your job. It's not your job only to treat the cooperative patient, the kids. You must treat both. And to treat both, you see, guys, how questions can be tricky. Imagine if this was your question exam and they ask you, you have brother and sister. The brother is cooperative and the sister uncooperative, or the way around. So which one you going to treat? Definitely both. Right? Very good. Now, both. Behavior factors. Cooperative, it's a bonus. Bonus. Uncooperative, I tell you what is the real scenarios, guys, in the real life. And definitely that can be a part in exam. Keywords. Think about the keywords. Patient is uncooperative. If that's all, no. You know what? They traveled 300 kilometers to see you. Imagine. The parents, they had to drive 300 kilometers to see you. And if the patient is uncooperative, you say, sorry, I cannot treat the child. You know what can happen? They will hate you a lot if you say this. So definitely in this case, you cannot say this. In this case, you say, yes, definitely, I will treat him. I have been trained in my school. I have been trained all my life how to handle and manage uncooperative patients. In this case, do you think the parents will love you or they hate you? Definitely, as long as you're gonna manage the situation, because you know what? The child will be in pain today. The child couldn't sleep last night. So in this case, we treat both. We treat the cooperative patients and the uncooperative patients, both of them. Now, how you treat the uncooperative patient? Can you please, guys, give me some behavior management and medical management as well? So now you have some behavior management, which is one of them medical, and then non-medical. Guys, you'll find all the stuff in Bidu Bytes. When you open the Bidu Bytes, you will find it there. Okay? So the most important thing we actually do in our clinic for kids is what we call it as tell, show, and then do. Tell, show, and do. Be careful. In exam, they can make it like this. Show, tell, and do. Why? Because in one part of SPQs is language and then sequences. This is because your exam is SPQs. So one part in SPQs is language and your attention to sequences. So please guys ensure it's the right one. Okay, so tell, show, and do. What other things apart from this? Non-medical. We talk about the non-medical. If your answer is for non-medical, is what we call it as voice control. It can happen sometimes, but we don't prefer it very much. But we prefer more modeling, right? When you make, you give an example, like say, you know what? I got your sister this morning. Look at her. She's very nice. And this normally, guys, what we do in the clinic. Why do the clinic? Because normally, guys, please, guys, listen to what I'm saying carefully. Because the scenarios will be exactly the way we see the patient in the clinic. At 2:30, if you work in Australia, you will find this. At 2:30, you will find the kids and the parents, the whole family, they come to you. They book as a whole family. What they do is you will find the mom comes for her appointment for scale and clean. She brings the husband or the dad, and then the kids with her. So I never start with kids. I always start with mom or with dad first. This is a part of modeling. Why? Because I use a dad as a good model, as a positive model, right? And then I, for example, if the child name is Sarah, I tell the Sarah, look at the dad, Michael. Michael is perfect. You see, he was very happy. Don his teeth. It's your turn right now, right? Be happy to jump on the chair. Yes, I'm happy. And then she jumps. Or I start with one of the kids, which I know from my record, there's a child, they love to do the treatment. And then let's say, for example, um, Mary. Mary, she's doing very well on the chair. So I start with Mary, and then I treat Mary's teeth first, and then I look at Sarah and see, look at your sister Mary. She's brave. She's a champ. She's perfect, fantastic. And then talk to her, and then they talk to each other. No, I haven't felt anything. It was very nice. I like my teeth now. That's a guy's called the model. Let's say pharmacological way. What could be? Nitrous oxide. Nitrous oxide. Do you think, guys, nitrous oxide, is it your scope or not? Yes, nitrous oxide in my scope. Do you know what you need to do? After you get your registration, upper registration, what you need to do only is 1 day course, 1 day course. And then you now eligible to do nitric oxide. Do we like to see every dentist? Do you think the country here in Australia encourage every dentist to do nitric oxide or not? Yes. Why? Because the case I mentioned right now, 300 kilometers, right? Drive to see you, and because you don't have nitric oxide, you tell them, sorry, I cannot manage him. So why did I travel to you 300 kilometers? You are the closest dentist. He's in pain. Do something today. So now, and if you got a question like this in exam, the answer yes, nitrous oxide. Don't say no, it's out of my scope. I cannot do it. You can do it. Information gathering. In the exam, they will provide you with X-ray or photo. Now, guys, we are in the, by the way, before I move to diagnosis of crown status, Am I clear, guys, about all the points I discussed right now? Yes, all clear. Thank you very much, Dr. Rabia, saying this. Okay. Now we are on diagnosis of crown. Thank you, Dr. Dipali, for saying this. I appreciate Dr. Catherine as well. Now, diagnosis of crown status. How important is the crown status? Let's talk mainly about baby teeth for now. This crown, how much damage in this crown? Let's apply right now IC-DAS system. In eyes, because in exam, definitely you're gonna get questions about dental caries. There is no dental exam in this life, guys, without dental caries. Now, if you're going to decide on IC-DAS, so which IC-DAS system is this dental caries? Is it code 1 or code 2 or code 3 or code 4 or code 5? Now, the enamel part is broken. So now we are not in code 0, we are not in code 1, we are not in code 2. Because code 0, no damage. Code 1, damage in the half of the enamel. Code 2 is damage into second half of the enamel. Code 3, you already crossed the dentino enamel junction. So you somehow now about code 3 and code 4, right? You're between code 3 and code 4, right? But mainly, I would say it can be code 3, because it just. Now, in code 3, how far is the pulp? Is it still far or too close? It is far. Now, in this case, do you think, should I do pulp therapy? Is your treatment right now is pulp therapy? No, pulp therapy will not be the best option. Fantastic. Let's now discuss the importance of the crown status, the crown condition. We are now into diagnosis of crown status or crown condition. Now, let's look at this. Let's say this is X-ray and this photograph. Okay? Now, the photograph. If you look at this X-ray or this X-ray, how deep is this caries? Very deep. Which code? It's code 5, right? Very deep in the pulp. Now, on X-ray, can you tell how deep it is? Yes. How do you know? Because you see right now the pulp is here and the caries is here, which is very close. And then on the photograph, can you tell in this photo how deep it is? Yes. How do you know? You see, guys, this margin ridge. Margin ridge is broken. Easy concept. In baby teeth. In baby teeth. If margin ridge broken means now the caries has reached the pulp. Again, if the margin ridge on the photo or X-ray broken, it means the caries is too deep into the nerve in baby teeth. Why? Because baby teeth enamel is too tiny. The thickness is too small. The dent is too small. The pulp is too big, too wide. That's why once major ridge broke, you will find yourself, it means it's a deep caries. In this case, will you do pulp therapy or just normal restoration? In this case right now, is it pulp therapy, or just restoration? If your answer is pulp therapy, you did very good. Okay, now we understand the importance of getting an X-ray like this or photograph. Now, can we recall this again together? Let's guys recall this together. If you have a scenario in exam, what you need to do? One, read the question to know the objective of the treatment you're going to do. Two, you need to read the keywords, including medical history. What else, guys, about for medical history? If the patient is cooperative or not cooperative, non-cooperative, how far they drove to see you. Then look at the crown status. How you can look at the crown status? You can look at the x-ray if provided, or the photograph. Any one of them mostly will be important. Now, let's make the question a little bit different. What if they provide you a photograph like this and they ask about the next step to do? Okay, guys, let's now make the question different. What if they give you this photograph in exam on the case, and then they ask you about what you need to do next? The answer is, thank you. Please, guys, like Dr. Nandini answer. X-ray. Dr. Shelpa answer. X-ray. Dr. Rabia, because you are endodontist, so you are very confident, so you're gonna jump into pulpectomy. Investigation option. Thank you, Dr. Hen. What sort of X-ray? Is it bite-wing X-ray? Or is it periapical X-ray or OPG? Which one in this case? If the answer is periapical X-ray, you're perfect. Okay, so now to recall again, one, you need to read the question to get the objective of the treatment you need to do. Two, you must check the keyword, including medical history. Two, if patient cooperative or not cooperative. Three, how far the patient coming from. Then you need to look at the photograph and then X-ray. If not given, you need to do X-ray, not vitality testing kids, because vitality testing kids not reliable. Once you have this information, now you can decide on mostly on the right information, on the right treatment. Okay, there is another two things you must think about them before you decide. One, the pulpal status, how it is. Let's say, by the way, guys, pinpoint exposure is a part of crown status. Because definitely, when you have this caries, the treatment will be restorative, which is different than when you have this pulp exposure, which it can be duct pulp capping or pulpotomy, depends on the objective, what exactly you need to do. And then when you have this type of caries, now you think about is it pulpotomy or pulpectomy. Now, What's the benefit to know about the pulp status? The pulp status will tell you, should you do pulpotomy or pulpectomy in baby teeth? Okay, let's say two different scenarios. Guys, which point we're on right now? Which guys point we're on right now? Diagnosis of pulp status, right? Okay. You have this tooth. You're not sure. What is the pulp status here? We have mainly. Anyway, guys, I was actually up to give you today all pulp. Have we discussed before, guys, by the way, because I was confused. I was very confused today. Have we discussed with you all pulp diseases, guys, before? Have we discussed together? Okay, so a session for all pulp condition? No, right? Okay, maybe that could be the next one. Diagnosis, yes? No, as no fees program, no, right? Okay. So yes, I don't know, some of you yes, some no, I'm not sure. Anyway, now status of the pulp. The status of the pulp can be one, normal. It can be reversible pulpitis. Three, irreversible pulpitis. Four, it can be necrosis, necrotic, on necropiosis, but just make it necrotic to make it easy for us. 5, it can be infected pulp. The pulp is infected inside. Now, we have two treatments for baby teeth. I'm talking mainly now about baby teeth. Pulpotomy, we're gonna move to the adult teeth soon. Pulpotomy and pulpectomy. Let's play this game together. In the scenario, it has mentioned patient just have sensitivity or tooth is okay. Let's start from 0 point. Start from scratch. Tooth is asymptomatic. If the tooth is asymptomatic, do you think the pulp right now normal or with reversible pulpitis or with irreversible pulpitis or necrosis or infection? If your answer is normal, you're perfect. In normal situation, when this case, when you have this photo in exam, do restoration. That's it. Now, reversible pulpitis. If it is reversible pulpitis, it can be either this with deep caries in the pulp or this. So if it just only C3 caries, do restoration. But if there is pulp exposure or pulp involvement, in this case, with reversible pulpitis plus pulp involvement, now both together, they can go to the treatment is now we have pulpotomy and pulpectomy. Pulpotomy means, right, we're going to preserve the tooth, right? Pulpectomy means we're going to preserve the tooth by by mummification, mummification, and this by debridement, and the removal of the pulp. Okay? Yes, and then you put medicine inside. Anyway, you're gonna put medicine in both. Now, we mentioned before, 1, reversible pulpitis, 2, irreversible pulpitis, 3, necrosis, 4, infection. Now, reversible pulpitis plus this, reversible plus this. What you need to do is pulpotomy. Irreversible pulpitis or necrosis or let's say it chronic infection, because in acute infection we may have different, okay, so chronic or controlled acute infection. In this case you go with pulpectomy. Is it clear now, guys, so far? So now reversible pulpitis plus this type of caries or this type of caries or this type of x-ray equal to pulpotomy. Now, irreversible pulpitis or necrosis or infection, which is chronic infection or controlled localized acute infection, plus this x-ray, plus or this photo, all of this you're going now into pulpectomy. I hope now, guys, you got the benefit on deciding on the pulp condition. How the pulp condition will be given to you in the scenario will be given this way. They will not tell you reversible or reversible stuff. That would be very easy. It can be, but that will be very easy. I doubt it. They will say, they give you keywords. For example, sensitivity. For example, pain for few seconds, pain only with hot and cold and disappear once stop eating or stop chewing. All the signs symptoms, right, guide you toward reversible pulpitis. Let's now discuss some keywords it can be in the scenario. Couldn't sleep last night. Spontaneous pain. Painkiller didn't work. Any one of these means irreversible pulpitis. I may surprise you. Asymptomatic, imagine, can be used for, guys, it's a big surprise, okay? Asymptomatic can be used for, if someone can say it before me, I will love this person very much. Asymptomatic can be a symptom for which condition? Chronic irreversible pulpitis, irreversible pulpitis, yeah, it can be a symptomatic, but more into, thank you, Dr. Parisa and Dr. Catherine, necrosis. Imagine necrotic tooth can be asymptomatic, guys, asymptomatic, no pain, okay, means no pain. Can be a necrotic tooth. Asymptomatic, yes, like dead body. Do you think dead people feel pain? But please, I don't want someone very smart. He tells me, I never been dead before. I'm not sure. Okay? Do you think, guys, because pulp, dead pulp, do you think dead pulp or dead people feel pain? No, asymptomatic, symptomatic, no pain. So necrosis can be asymptomatic, no pain, because dead tissue. But infected necrosis is symptomatic. So once you get into infection, now symptomatic. I believe now. So now, if the tooth is asymptomatic and you see this caries or you see this x-ray, what's the treatment? Restoration or pulpotomy or pulpectomy? If I know, guys, maybe you have attended this session before, but now we're getting completely new information, right? Thank you. Thank you, Dr. Razo. Pulpectomy. Yes, because we said asymptomatic mean necrosis, especially if there's pulp involvement. So now pulp involvement plus necrosis, which is asymptomatic, equal to, let's say, pulp involvement plus asymptomatic equal to necrosis. And necrosis take us toward pulpectomy. Very good. What about infection? Let's discuss infection right now as well to finish infection. Infection. Guys, would you like me to discuss infection right now or later on? If the tooth is infected, we have two types of infection. Guys, please let me know. I think it's better to finish it now, right? Okay. Infection. You have two types of infection, either localized infection, which is controlled, or spreading odontogenic infection. In a baby tooth, if the tooth has just localized infection, you know what, guys? Now, after the session, you need to eat too much after the session. Why? Because your brain will need lots of glucose, lots of sugar. Guys, you ready for this? Are you guys ready for this? We're going to play lots of games right now. I will keep changing lots of things. Okay? Okay, now. Give me, guys, 1 second, because actually we need to get our team to help you and admit you. I know most of you right now on the Facebook, right? Okay, anyway. Infection. When there is just localized infection, like a small abscess, in this case, you do pulpectomy, as we mentioned before. But if it is spreading odontogenic infection, right, with or without severe feature, it's better to do extraction. Let's say this again. Infection. You have two ways, chronic or acute, but it's localized. In this case, do pulp therapy, like pulpectomy. If the infection is a spreading odontogenic infection, it's better to do extraction. Why? What is the reason behind this? Why we prefer to do extraction in spreading odontogenic infection. What is the main reason behind it? Do you remember when I told you before, you need to be a safe dentist and you need to apply what we call it as risk-benefit analysis? Do you remember that time? We're talking about baby teeth so far. I'm talking about a baby tooth so far. Baby tooth, okay? What is the reason? Guys, in exam as well, you must be choosing the most significant answer based on the keywords. Now, what is the main reason in a child with a spreading dentogenic infection that you may need to go in extraction rather than root canal treatment? Guys, which concept in this? When you focus on the right reason, we call it as yes, the train or the kebab and train station concept, right? Now we're talking about the train station and the kebab shop concept, right? Now, the question asking about the reason that you do extraction rather than pulp therapy, like pulpectomy, when the patient has a spread odontogenic infection, because the pulp canal anatomy and system is complex and complicated. I've been looking, guys, at your comments if someone has answered this, but so far no one has answered, guys. So again, the reason behind it, that we do extraction rather than pulpectomy in this child, in the baby tooth, because pulpectomy will not be successful because the pulp canal system is complex and complicated. So if you go into decide to do pulpectomy and got debridement, let's say got debridement and got cleaning, while there's odontogenic infection, your treatment may not be successful. And in this case, if it's a lower tooth and then the pulp system is complicated with a spreading odontogenic infection, you may end up with, you see, I'm telling you, you need to eat too much after the session. Your brain needs lots of sugar after the session. If you decide to do pulpectomy in a baby tooth with a spreading odontogenic infection, and if it's a lower tooth, lower, and then the pulp system is complicated, a new pulpectomy will fail. What sort of complication what sort of medical condition or complication the patient may end up with? Something that starts with L letter, and it is German name, I believe. It's the name of the person. Yes, cellulitis, but what sort of cellulitis? You're very close. It's cellulitis, but what sort of cellulitis? I will help you guys in this. I was just thank you, Dr. Much. Thank you very much, Dr. Parisa. Dr. Parisa said right now, and Dr. Ryan, Lord vagina. The same thing, okay? If this is guys going to happen, okay? If this is a condition for upper teeth, what sort of complication you may get? Life-threatening condition, life-threatening complication for upper teeth. You see, I discussed with you lots of concepts right now in only one point. So please, guys, get all these concepts written. I'm waiting for the right answer. I'm answering this question. While, guys, there was one question here. I couldn't see it. Okay, I cannot see the question again, but there was one question here. Cavernous sinus thrombosis. Thank you very much, Dr. Sonia. Cavernous sinus thrombosis. Maybe Dr. Roz as well mentioned it too. Okay, you got it right now. What is, guys, the signs? What is the biggest signs of cavernous sinus thrombosis? There is one sign, let's say, two signs. What are the most important two signs for cavernous sinus thrombosis? Something related to the eye. Sepsis, it's a broad word. I agree on it. It's a sepsis condition. Something happened to the eye, Dr. Sneha. Close the eye. How we call it? But not just to close the eye, it's the eyelid. Okay, make it more close, guys. It's the eyelid. Something can happen to the eyelid. Thank you very much, Dr. Anika. Drop the eyelid. Guys, that thing's very important for you to know, please. Okay? Drop the eyelid. Very good. What is the most second important guide thing for cavernous sinus thrombosis? The most second important thing, guys. Patient with cavernous sinus thrombosis will get with something very, very severe as well. If something in the head itself, we normally have it. We normally have it when under pressure, under stress. Okay, severe headache, guys. Okay, if you wrote it down, severe headache. Definitely is elevation of temperature, but severe headache. Okay. Now, so that's why we don't actually prefer to do pulp therapy in kids with. Wow, Dr. Angela mentioned. Dr. Angela said headache. You're great, and Dr. Mariella as well, and Dr. Hemant. Good job, guys. Okay. Unilateral headache. Even Dr. Anika is more specific. Yes, you're right. It's unilateral headache on the side of the infection. Okay, very good. Now, we learned about this part. Now, let's take you back again. Chronic infection or localized infection. What's the treatment? Extraction or pulpectomy? Okay, pulpotomy or extraction or pulpectomy on kids. We're talking about kids so far. Is it extraction, pulpotomy, or pulpectomy? Pulpectomy. Fantastic. Pulpectomy. Let's now add one more keyword. Child has type 1 diabetes, and it is uncontrolled type 1 diabetes. In this case, what you need to do? Patient is immunocompromised. Now, there is infection. The child has uncontrolled type 1 diabetes. Thank you very much. You see how one word has changed your treatment? Extraction. Perfect, guys. Perfect. Let's play the game again. The same things. Child. Baby tooth. Let's say 85. Tooth number 85. Localized infection. Plus root resorption. What's the treatment? Extraction. Thank you. Extraction. Now, let's apply the same things. Instead of root resorption, we're going to say furcation involvement. Furcation involvement. What's your treatment now? Extraction or pulp therapy? Extraction. Very good. Do you know how many concepts we covered right now? I believe not less than 70 to 100 concepts. If you wrote down this concept nicely and then go through them, believe me, you're not just only revising right now pulp therapy, you're revising a part of root canal treatment, a part of restoration, a part of surgery and extraction, right? Okay. You see from one slide, how many concepts, guys, we can discuss? Diagnosis of periodontium status. What sort of periodontium, periodontium, guys, we need to discuss. So now, periodontium. Periodontium, it can be, as we mentioned, infection. If this is the shape of the root, what do you think the infection now? What sort of infection it is? Brainstorming, please, guys. Brainstorming. If this is the shape of, because immunocompromised, Dr. Parisa, safe dentist. Imagine if there is infection. There is an abscess, infection down there, and the child is immunocompromised. Do you think your root canal treatment will be enough? Will be better and safe, or extraction will be safe? If this is a shape on X-ray, we now talk about either apical periodontitis or abscess, periapical abscess. Now, if this is the infection, sorry, if it looks like this on X-ray, it looks like this. What does this means? What it means? This again, it can be an abscess, mostly chronic abscess. Chronic abscess, right? Now, What? It looks like this. The periapical. What does it mean? The radiolucency looks like a ball hanging from the apex. What does it mean? If your answer is granuloma, you are right. Thank you, Dr. Shelba. Perfect. If radiolucency here, mostly it's furcation involvement, right? If you have root resorption, it will be showing. Now, let's say patient, look guys at the keywords, okay? Look at the keywords right now. Patient age is 10-year-old and tooth number 84. And the tooth has infection plus chronic infection. What is the treatment? How to identify cyst? Cyst is like this. This radio-opaque zone or margin, like this one, will be radio-opaque, and the inside will be radiolucent. So it's well defined radiolucency surrounded by well-defined radio-opaque zone. Radio-opaque zone. That's a cyst. Extraction. Why extraction? Because the tooth is going to exfoliate. The age is 10-year-old. 10-year-old. Now, tooth number 84. Like this one. Right? This is mostly 84. Now, if the child is 10-year-old and this is 84, so what's the treatment? This actually got, that's the upper, by the way. That's not 84, that's upper. This is 764. Because that's 65. And most probably that's 16 here. The hidden one is 16. Okay? So in this case, extraction. Why? Because the tooth is too close for exfoliation. What does it mean? It means the root is resorbed. So now, can I do pulp therapy if the root has more than 1/3 of root resorption? The answer is no. When this condition happens when the tooth get into the last year before exfoliation. Now, periodontium is very important. Diagnosis of periodontium. Diagnosis, we already went through it, and we mentioned about healthy tooth or just a cavity. If it's a healthy tooth, the treatment will be restoration. Just a cavity, healthy tooth, do nothing. Just say the patient, perfect job, you did very well. Just to follow the same routine. Just a cavity, do restoration. Pulp involvement, we need to decide. Is the pulp involvement here? Guys, our session is today, right? Our private session, guys, tomorrow. We need to start early. Guys, we'll be able to start early tomorrow at 7 just to finish as much as we can from concepts. Yes, guys, would you like to be 7 or 8? 7, yes? Okay. Okay, guys, so our private session tomorrow, guys, is at 7 p.m. Guys, did you get tired or not yet? Guys, did you get tired or not yet? Yes, tired? Always tired or always 7? Yes, say 7, 7. Yes, always 7. Okay, yes, 7. Okay, 7 is good. Okay. Dr. Shelban now, yes, tired. Okay, guys. So should we continue tomorrow? Always tired, sir. You need to sleep then. Do some sports and then sleep, okay? Okay, guys, that's fine then. If you're tired, we can stop here and then we can discuss this tomorrow then, okay? What do you think? Need sugar? If you stay more, we still need more sugar. Dr. Tanvir, yes, it's still we gotta discuss about smoking and disk derangement again, because we already discussed about disk derangement. This is we're going to be this week, right? Not tired, exciting concepts? Okay. Go back to clear your concepts regarding this. Okay. No time, guys. Thank you, Dr. Vido. Yes, okay. Okay. Okay, guys, we can stop here for now. Okay, because I don't want any one of you guys feel tired. By myself, I feel tired, but still happy to help every one of you. Not tired now? Okay. Okay, guys, that's fine. Okay, no problem, guys. Thank you, every one of you guys. Was very happy to have all of you today. That's okay, guys, then, okay? I know some of you want to stay and some really feel tired, so that's okay then. Let's just say thank you very much for tonight's session. Proceed forward. That's okay, Dr. Ken. Like, not tired. That's okay, guys, because some of you still tired, okay? Thank you very much, guys. See you then tomorrow. Starving now? Yes, Dr. Marla, I know this. Okay, see you guys tomorrow. I was very happy to have all of you guys here tonight. Thank you very much for saying thank you for me, Dr. Shashank. I really appreciate this. I hope, guys, you enjoyed the session. Thank you, Dr. Rabia. Thank you, Doctor. Every class, we learned so much. Thank you very much, Dr. Rabia. It's my pleasure. Thank you, Dr. Teslim, very much, saying thank you. I'm very happy, Dr. Shashank, that you found it wonderful session. It's my pleasure. Thank you, Dr. Ken. No problem at all. Bye-bye, Dr. Ken. I really appreciate this. Thank you, Dr. Walija. Thank you for coming today. Thank you, Dr. Mariella. Big, big hearts, Dr. Mariella. Thank you, Dr. Ryan, as well. Thank you very much, Dr. Ryan. Thank you, Dr. Torika, and Dr. Pishaus as well. Thank you very much, guys. By the way, guys, I will be in Melbourne because I will be in Melbourne Academy for this week or next week. So please, guys, if you need any help, you are very happy to come and you're very welcome to come and see me in Melbourne Academy. Okay, guys, thank you very much, guys. Amazing, amazing class master. Thank you very much, Dr. Mariella, for coming and attend the session. I'm very happy that you like it. Thank you, Dr. Penn. Thank you. Thank you, Dr. Natalie. Thank you very much, Dr. Natalie. Thank you very much, Dr. Leo. Thank you, very much, Dr. Rahini. Thank you, Dr. Paris, very much. Thank you, Dr. Razo. Thank you, Dr. Mariam. And Dr. Ajana, thank you. Thank you, Dr. Kamel, as well. Thank you very much, Dr. Shabir. Thank you, Dr. Leah. Thank you, Dr. Sneha. Good night to you, Dr. Sneha. Thank you very much. Yes, Dr. Ken, actually in the plan, right? It's already in the plan. And then I will be sharing by tonight or tomorrow morning. We'll be sharing the mock questions. Okay. So the plan will be paper 3, section 2, and that's mainly okay, that mainly about dry mouth. The topics mostly about dry mouth, I believe, and then with the topics as well will be ulcers, all the ulcers, all the condition of dry mouth, all medications related of dry mouth, right? And then will be also oral medicine, including swellings, including vesicles, lesion with vesicles, or blisters. We discuss all these questions related, all the more questions related to these topics and all the concepts related to these topics, okay? Please follow the plan. You will find all the stuff there, and you'll find it in the Google Drive. All this stuff, please. And tomorrow, but before the session, as I always say, I always do, I will be sharing these questions, and then you can take it as a mock and test yourself, mark the questions, answer them, mark the right answers, and after you mark the right answer, when I discuss them with you, you find out how many questions you did correct and how many questions you didn't do correct, you didn't do right, and then you will learn from the explanation I will give you, okay? No problem, Dr. Lakshmi. Thank you, Dr. Lakshmi. Thank you, Dr. Harisha. Thank you, Dr. Aldara as well. Thank you very much. If we have some query, we should ask. As I am 30, definitely, you're very welcome, Dr. Ken, to ask. It's my pleasure, definitely. You can ask at any time, Dr. Yes. Even ensure you are in the private group, not the private, still it's private for my private group, but still you can join it. It's called Australian. I can't remember the name of it. Bidu Bytes. Sorry, a Bidu Mediators group. Okay, definitely you can ask as much as you can question. Thank you very much, guys. See you then. Bye bye. See you tomorrow then. Thank you very much. Bye bye. Have a great night, everyone of you guys. Thank you. Bye bye.